If you were following the conflict with HSAs, health savings accounts, and Medicare in the first proposal of the One Big Beautiful Bill this summer, and you didn't follow through to see the final version that was signed into law, then you don't know that the rule didn't change. We still have this ridiculous conflict with Medicare Part A and Part B and a health savings account. So for new agents out there that don't know this, and you might be an older agent but still not know this, I want to go into the rule how health savings account contributions work, specifically conflict with any other type of health insurance. So let's say I'm getting ready to turn 65. I want to continue to work. I have a health savings account at work and I want to continue to contribute to it. And I want to continue to get those sweet employer matching contributions. In order to do so, one, I cannot be on Social Security, because if you enroll in Social Security at age 65 or older, it automatically comes with Medicare Part A. You don't have the ability to carve it out to terminate Part A. It is a package deal if you were 65 or older. So one, you won't take Social Security. In most cases, you wouldn't have done that anyway because you're working full-time and you're under your full retirement age, so you wouldn't take Social Security due to the earned income limit. I have other videos explaining that if that's all unfamiliar territory for you. So let's say I'm turning 65. I want to continue to contribute. I'm not on Social Security, but my HR director told me I need to enroll in Medicare Part A. I cannot tell you how many people are in my comments telling me this. And I don't know how to get to these HR directors because the company only has an HR director if they have a large company. And these people are giving wrong information. They are telling people that are turning 65 they have to enroll in Medicare Part A, which is not true. Now, normally it doesn't hurt them. It doesn't typically benefit them, but Medicare Part A is premium free for most people at 65. So if they do enroll in it, as long as they don't have a health savings account, it's actually beneficial in the end because later when they do retire, they're already in the system. They already have a Medicare ID number, and it's quicker to get B and to get rolling when they do retire. So normally, it's pretty good advice. But the HR directors out there, they need to caveat their advice and say, you should talk to your insurance agent about this. Or they should say, do not sign up for Medicare Part A if you want to continue to contribute to your health savings account. Now, don't confuse a health savings account, which is a win-win-win, a triple win. Money goes in tax-free, grows tax-free, comes out tax-free if you do it correctly, with a flexible spending account, an FSA. An HSA is portable. So if I change jobs, it goes with me. If I die, it can go to my estate, to my beneficiary. It's my money. A flexible spending account is owned by your employer. If you leave your employment, you leave that money on the table. So we're talking about health savings accounts, HSAs. If I'm 65 or older, I cannot have any other form of health insurance, which means I cannot have Medicare Part A. So do not enroll in Medicare Part A. That's easy advice to give them. The hard part is planning when to retire, because the second part of this rule that is causing the most confusion for your clients is that when you enroll in Medicare Part A past age 65, the government makes it start 6 months retroactive. What? Why do they do that? Because their thought process is, Sylvia's enrolling in Medicare at age 68. She probably made a mistake. So they're trying to give me a break, and they'll say, we're going to start her Part A at 67 and a half. We're going to retroactive it back 6 months. That way, if she had any Part A claims, she would get coverage. So somewhere, one of the Congresses along the way thought that was a great idea. Okay, it's fine. But when it comes to a health savings account, that creates a big tax problem because you have to stop all your contributions now 6 months before you plan to retire. So if I know I want to retire and go on Medicare at 68, I have to stop all contributions at 67 and a half. Give yourself a 1 month buffer there, which means I have to stop my contributions and my employer's contributions. So I have to know when I want to retire. Well, sometimes you don't have any control over that. Sometimes I just get fired and boom, I wasn't planning on quitting work at 67. I wanted to quit at 68. I got fired today, and I was still contributing this month. Now what do I do? Well, you do have a problem. There's ways to fix this problem. You can back out your contributions to your HSA for the past 6 months. I didn't say it was easy. I said there's a solution. That means your employer has to back out those contributions, but you really wanted that money. Your employer has the ability to reclassify those contributions and potentially, just bonus you that money. That's okay. That's legal. But they can't be classified as HSA contributions from your employer or from you within 6 months of starting Medicare, or you're going to have a problem with the IRS. You're no longer meeting the qualifications to have a health savings account, tax-deferred benefits. So it's possible. Even if you've already gotten your W-2, you can ask to have it reissued. You can try to back this out. It is a pain, but it is possible. Again, if you don't do it, you're going to get hit with a 6% IRS excise penalty because you didn't follow the HSA rules. So what you're telling your clients is this rule that's been on the books for years, that all summer long they were hyping up that the one big beautiful bill was going to get rid of the conflict, didn't. The final version that was passed into law did not fix it. So if you want to continue to contribute to a health savings account and you're turning 65, make sure that 1, you don't take Social Security, 2, you don't enroll in any form of Medicare, and 3, ideally, you stop all your contributions 6 months before you do want to sign up for Medicare in the future. Your clients need your advice because nobody is telling them this, and God knows their HR director is often giving them incorrect information. So I hope you're able to pass this along to your clients. Maybe you want to rewind this video so you know you have it down pat so that you can put this out to your clients and save them a lot of frustration and tax penalties. Thanks for watching. If you don't subscribe to our channel, I'd appreciate if you'd give us a follow. Thank you.